They're under intense strain here, but surviving so far. Doctors and nurses at Milton Keynes A&E working flat out for days to manage demand. But from elsewhere in the NHS come reports of services failing to cope. On Twitter, one A&E consultant reported he'd run out of corridor space for patients. Another used mobile screens to split resuscitation bays into two, while a hospital chaplain has described holding the hand of a dying man in a corridor for an hour until space could be found. But NHS bosses insist describing this as a crisis is wrong.
God help us when the real crisis comes in. The target to see patients within 4 hours is 95%. Many departments are as low as 40% of that target. So this is a crisis.
Hospitals in England had already been allowed to put off scheduled surgery over the Christmas period, but now, if they need to, they're going to be allowed to postpone routine operations and scheduled outpatient appointments for the whole of January.
If yours was the hip replacement that was cancelled, and you're going to have to wait an extra month for that, you could be in pain, and that is unacceptable, and I apologise wholeheartedly for that.
Lisa is one of the thousands that apology was aimed at. Her appointment to discuss surgery to remove a vaginal mesh has just been postponed till March.
Is it going to be a case of come February, another letter is going to fall on my doormat, and March's appointment is going to be pushed back to May, or it's going to be pushed back to August, and then by that time there's a device inside me that's going to have been inside for 18 months. I can't even begin to think about that.
For now, the boss at Milton Keynes isn't planning to cancel routine operations this month, but that all depends on whether the surge in patients needing a bed continues.
The patients that are coming through our doors are frailer, they are more sick, and they are staying in our hospitals longer, and that's what's causing the pressure. If you combine that with some of the other factors like flu, like we haven't had any real downtime in the NHS, that's what's tipping us over at the moment.
Last year, the really intolerable pressure lessened after a couple of weeks. At this stage, it's impossible to tell if this year the health service will be as lucky.